Welcome in to Dr. Joel Saylor's place. It's actually our place here at the radio station, but it's his place too, every Monday, Wednesday, and Friday on the radio, and at any time on demand, 24/7, 365. This week we're going to be talking about prescribing guidelines, rules and regulations, if you will. Doc Saylor.
Yeah, I want to talk a little bit because we get asked this question a lot. I mean, I have friends that come up to me and they hear about new products and say, "Oh, wait, cool, can I get that from you?" And so sure you can. It's not a problem. With Brevecto coming out, which is a flea product. That's a prescription drug,
okay.
and so are heartworm preventions and things like that. And so I wanted to kind of clear up a little bit of confusion because every once in a while we get asked, and sometimes people get upset. It's like I need to get some heartworm prevention for my dog. Okay, that's great. But there are some rules that we are bound by Florida and federal law. So the first thing we will describe is what's called a doctor-client-patient relationship. Now, that's different from the human side because they only have a doctor-patient relationship, okay? But for us, we have a doctor-client-patient relationship, okay? So it's what basically it's a DCPR, all right? So doctor-client-patient relationship. Okay, a doctor-client-patient relationship in the state of Florida is defined by a doctor that has seen the patient within the last 12 months. Okay? Because that kind of makes sense. If you haven't seen an animal in a year, you probably have no clue what's happening with the animal, right? Okay. So that's the reasonable rule. Now, so if it's under that 12-month guideline, great. Okay? Then you can prescribe drugs to them. If it's beyond that, you cannot. So even though it's a simple thing like a flea product that's probably not going to cause any harm, like Brevecto, okay? If you come and you walk off the street and say, I want to get the new flea product. Well, if we've not seen the dog ever, or we've not seen your dog in 12 months, by federal law, we can't. And it's not like we're trying to, force you to come in. It's a matter of if we prescribe that, if the FDA so chose, they could drop the hammer on us because we've violated federal and state law.
Right.
And I do know that there are places where you can go pick these things up without a doctor, but I will tell you that that is a violation of Florida and federal law. If you are able to purchase it without getting a doctor's visit and you haven't seen a doctor 12 months, that is against the law. Okay? So again, so if your veterinarian says, no, you need to come in because I haven't seen your pet 12 months, it's because they're protecting their license. Okay? Now, let's contrast that with a heartworm prevention. Okay. Now the heartworm preventions are a little different because you have to abide by federal prescribing laws. Okay. But then in addition to that, the manufacturers want to know the heartworm status. Okay. And so what is generally accepted in the profession as knowledge of heartworm status is an occult heartworm test once a year. Okay. Now you really want your veterinarian to do that. Okay, and the reason is because if you can do that and establish that and have a track record of those occult heartworm tests, should your pet ever come down with heartworm disease while they're on the heartworm prevention, the companies will guarantee the product and they will pay for heartworm treatment. And guess what? We do have breaks. In Mississippi, there's been quite a few cases of patients that have been on heartworm preventions that developed heartworms, okay? And so in those situations, those patients that the veterinarians were doing routine occult heartworm tests, those were paid out.
Yeah.
And those companies paid out.
Otherwise, the pet owner wouldn't have any recourse. And also, it's good for your pet. I mean, your pet should be seen by a vet at least once a year.
Absolutely. The physical exam once a year. But again, so just to kind of clear things up, and where some of the confusion comes from is there's products that are EPA products. Okay, let's talk about just Advantage, okay, or Frontline. Those are EPA products. Those do not require a DCPR, okay? So, because, again, it's not a prescribed. So if you walked off the street and said, listen, I'd like Activille, or I'd like Advantage, or I'd like Frontline, no problem. Here you go. See you later, okay? And so those are the things, so knowing what you're asking for, if it has an FDA legend, meaning it's a prescribed drug, yeah, they have to have seen you. Okay, and again, if it's another drug like a heartworm product that has some requirements along with it as far as guarantees and stuff like that, there may be a couple extra hoops. But the good news is, if you don't want to have an exam, there are products out there like Activille that are EPA products that don't require that. So again, make sure that when you're asking, you're not asking your veterinarian or a veterinarian to do something that really is going to put their license in jeopardy.
Indeed. We'll be back right after this message.